Clinical laboratory science. The clinical laboratory staff is responsible for testing blood, urine, tissue, and other body fluids using a wide variety of technologies. Besides problem solving, clinical laboratory scientists provide physicians, PAs, and nurses with laboratory information and services needed for diagnosis, treatment, and prevention of diseases. It has been estimated that 70 to 80% of clinical decisions are based on laboratory test results. One of our main goals is to clearly and professionally communicate with clinicians so patients can receive the best treatment possible. Medical laboratory scientists have a Bachelor of Science degree in medical technology or clinical laboratory science. After receiving their degrees, they sit for a certification exam that tests all areas of the laboratory. Some but not all states require clinical laboratory scientists to become licensed. Many laboratory scientists have advanced degrees, and some programs have an entry-level master's degree. Specialists may hold doctorates in microbiology, chemistry, hematology, molecular diagnostics, management, or education. The doctorate in clinical laboratory science is a relatively new degree. Doctorates of clinical laboratory science practitioners will be part of the team helping clinicians determine the right laboratory test at the right time for the right patient. Our work occurs behind the scenes as we perform analytical testing. In addition to clinical testing, we operate, maintain, and troubleshoot expensive, technologically advanced instruments and equipment. I will tell you about each department. The hematology department performs a complete blood count, or CBC. The CBC will give information including cell counts and identification of specific cells. We can also determine hematocrit or hemoglobin levels. The hematology department can diagnose various conditions such as anemia and leukemia. This requires advanced expertise to precisely identify cells and morphology. The coagulation laboratory offers expert interpretations of coagulation profiles and consultations for diagnosing and managing patients with bleeding and thrombotic disorders. An extensive battery of tests is ordered using advanced and progressive technologies to pinpoint the cause of disorders. The chemistry department quickly analyzes the chemical composition of the blood and body fluids using state-of-the-art technology. Comprehensive metabolic and renal function panels would be ordered on patients with diabetes, stroke, and myocardial infarction. These panels would determine blood glucose, lipid panels, electrolytes, liver and kidney function tests, among others. Toxicology tests can determine if a patient is taking certain drugs and if the dose is correct. Hepatitis and HIV antibody tests can also be performed. A urinalysis is one of the most commonly performed laboratory tests. This test is to determine the chemical and microscopic contents of the urine. They are most commonly used for diagnosing kidney disease and urinary tract infections. Instruments perform the biochemical tests and take photos of the urine sediment. These photos are identified and then verified by a clinical laboratory scientist. Specimens from patients with advanced kidney disease require expert microscopy. If a patient requires a blood transfusion, a sample of blood is sent to the blood bank. Once there, the blood bank personnel run tests to type the blood and perform a cross-match between the donor cells and the recipient's serum to detect antibodies. This will decrease the likelihood of a transfusion reaction occurring. Prior to transfusion, each blood unit stored in the blood bank is typed for blood group, screened for antibodies, and tested for contagious diseases. Red blood cells, platelets, and fresh frozen plasma are the primary products used in the hospital. The staff supplies all the blood products necessary for transfusions and carefully dispenses it to nursing personnel after being thoroughly checked. The microbiology department in the lab is responsible for detecting disease-causing bacteria, fungi, parasites, and viruses which may be identified and isolated from blood, urine, sputum, cerebrospinal fluid, and other body fluids, exudates, and wounds. This is possible by performing biochemical tests. A mass spectrography instrument that measures proteins of organisms by matrix-assisted laser desorption and ionization time of flight can provide the identification of an isolate in less than 2 minutes. Microbiologists also determine which antibacterial drug will be successful against the infectious organisms by performing susceptibility tests. Once identified, appropriate infection control measures can be carried out. Molecular diagnostics is a rapidly growing collection of techniques used to analyze biological markers in the patient's genetic code and how their cells express their genes as proteins. With the discovery of polymerase chain reaction, many disorders can be precisely characterized. Molecular diagnostic tests detect specific sequences in DNA or RNA that may or may not be associated with disease, including single nucleotide polymorphism, deletions, rearrangements, insertions, and others. Many molecular laboratories pinpoint the type of cancer a patient has to meet the needs of individualized medical treatment. Infectious diseases that cannot be easily cultured can be identified rapidly. Genetic diseases can be characterized. If a patient needs an organ transplant, human leukocyte antigens can be detected through molecular diagnostics. Clinical laboratory science employment rates are projected to grow 16% over the next 10 years. Since advances in molecular diagnostics, many laboratory tests have been developed to detect disease more precisely than ever before. Many tests are becoming more sophisticated and automated. This combination of precision and automation is the direction the laboratory profession is moving. This allows the clinical laboratory scientist time to solve medical problems that were not known to exist in the past. Our case study patient. Although there are no specific laboratory tests for diagnosing stroke, laboratory tests will always be performed to rule out other diagnoses and identify the status of our patient's chronic condition. Her lipid panel will let us know if she has high cholesterol and an abnormal lipid panel that is commonly seen in strokes. Because she is a diabetic, a blood glucose would tell her current state of glucose control, and an A1C test would tell if she was in control over the past 90 days. If her alcoholism is severe enough to affect her liver enzymes would show damage to liver cells. Coagulation studies may demonstrate a bleeding or clotting disorder. If anticoagulants are given, her blood will be monitored for optimum dosage. If she becomes septic or develops pneumonia over her course of treatment, the microbiology laboratory will identify the microorganisms responsible and test its susceptibility. Hematology tests will follow her white blood cell count and differential. Laboratory tests will be performed throughout her hospital stay to monitor and assess her progress.